Good morning, everyone, and welcome to this webinar where we are going to be talking about Salt Awareness Week 2024, sodium reduction targets, tools for development and country experiences and implementation. To use the interpretation function, you can look at the bottom of your screen and you will see a small globe, and there you can choose either English or Spanish, or you can listen to the original audio. To begin the webinar, I am going to turn the moderation over to our regional advisor in nutrition and physical activity, and I would ask all the speakers to keep their camera off until they are ready to speak. So with that, I call on Leo Nederveen, who is going to be our moderator. Thank you, Luis, and welcome everyone to this webinar. Here we're going to be talking about the evidence of sodium consumption in processed and ultra-processed foods. We will be sharing experiences of countries in the implementation of regulations on sodium in the countries of the Americas, and also we will be looking at other aspects of sodium consumption. I am going to call on Dr. Vanessa Garcia Larsen. She is Unit Chief of Risk Factors and Nutrition in the Pan American Health Organization. So Vanessa, please go ahead.
Thank you, Leo, and thank you everyone for joining us today. Welcome to the Salt Awareness Week 2024 webinar to shine the spotlight on salt. PAHO is very pleased to organize and conduct this activity and join the international community and our member states in promoting further policy actions to reduce salt consumption and protect the health of our population. The largest number of diet-related deaths, an estimated 1.89 million per year, is associated with excessive intake of sodium, a well-established cause of raised blood pressure and increased risk of cardiovascular disease. It is estimated that the daily average of global sodium intake is 10.78 milligrams of salt, which is more than double the WHO guidance of less than 5 grams of salt per day, equivalent to a teaspoon. In the Americas, salt intake is about 8.96 grams of salt per day in 2019. And our region is not on track to achieving the global target of reducing sodium intake by 30% in 2025. Reducing sodium intake is one of the most cost-effective ways to improve health and reduce the burden of non-communicable diseases. The Pan American Health Organization supports its member states in reducing salt intake by implementing the WHO SHAKE technical package. The region of the Americas has made advances in implementing the best buys for sodium reduction. For example, 12 countries so far have adopted front-of-package nutrition labeling of processed and ultra-processed foods with excessive sodium content, and 7 countries, including Argentina, Chile, Ecuador, Mexico, Peru, Uruguay, and Venezuela, have started implementation. However, in light of the observed increase of the consumption of processed foods, a reduction of the sodium content in foods is necessary to be implemented on a mandatory basis. PAHO and WHO have developed different tools to support member states, including the set of updated PAHO regional sodium reduction targets, which was developed in collaboration with the WHO Collaborating Center for Nutrition Policy for Chronic Disease Prevention at the University of Toronto and launched in October 2021. This year's theme for Salt Awareness Week highlights hidden salt in many processed and ultra-processed foods, which in some countries contribute to about 70% of the sodium intake. Today, we will hear from researchers from Colombia and Uruguay on sodium intake from these products in children and adults, and how this increases the chances of not meeting the WHO intake guidelines. Later, we will learn from the 10-year experience of Argentina in implementing and evaluating sodium reduction targets, and from the most recent experience of Colombia in the development, approval, and implementation of a comprehensive set of sodium reduction targets. Also, PAHO and the WHO will present some of the tools developed to support our member states, including the updated PAHO regional sodium reduction targets, as well as the SHAKE technical package, which provides detailed and practical steps to implement the best buys for salt reduction. We thank you for your participation, and we really hope this webinar continues to motivate and support countries to implement cost-effective sodium reduction policies using the tools developed by PAHO and the WHO. Thank you.
Muchas gracias, Vanessa, por estas palabras de inauguración.
Thank you very much, Vanessa, for those introductory remarks. I wanted to tell everyone that we do have interpretation for this webinar. At the bottom of your screen, you will find an icon that says interpretation, and you can choose either English or Spanish. Now, we have a series of speakers, as Vanessa just said. So we're going to begin with the first presentation. If you have any questions, you can send them to us on the Q&A. You can find that at the bottom of your screen, and we will try to be answering the questions during the webinar. But there's also a space for discussion if we have enough time. We'll have a Q&A at the end of the webinar. So with that, I turn to our first speaker. This is Gustavo Cediel, and he is from the unit of issues in public nutrition. He is from the University of Antioquia in Colombia. He is a nutritionist, a dietitian, and he has both a master's degree and a doctorate. He also has a postgraduate study in nutrition, and he is a researcher at the University of Antioquia. Dr. Cediel is going to be speaking about the consumption of sodium in Colombia's population. So with that, I turn the floor over to Gustavo Cediel. Thank you. Good morning, everyone. Let me put my presentation on the screen. Please confirm if you can hear me and see my slides. Yes, we can see you very well. Thank you. I wanted to thank PAHO for this invitation, and I will be speaking about the consumption of sodium in Colombia. I report no conflicts of interest. In Colombia, 1 out of every 10 people, more or less, has hypertension. We know that it is one of the main triggers of cardiovascular disease, and something like 61% of the high blood pressure cases occur in women. We know that sodium is one of the highest determinants of hypertension, and in Colombia, we have come to realize that most of the sodium in our diet is contained in processed and ultra-processed foods. 20% comes from cooking. In other words, that's the salt that we put in things we cook, but that means that this is sodium in the natural food form. Now, the other 70% is the major source of sodium in our diet in Colombia, and that comes from sauces, from broths, from sausages, and other packaged foods, sardines, other things of that nature. Now, as you can well imagine, what we are aware of in Colombia is that the degree of industrial processing, in this case, that's the industrial ultra processing of food, has an effect on health. If we compare that with what we can call natural food or cooking at home, that means that the ultra processed foods are something with a deleterious consequence on health. That is what we have come to realize in Colombia, especially in looking at health, the quality of our diet. And this is something that, of course, we are trying to create awareness of in public policy. So basically what we're taking is that the problem of nutritional science currently based on a specific nutrient, in other words, without looking at the source of where food problems come from. In other words, we're trying to look at nutrients outside the context of the food, or the food outside of the context of the diet, or the diet outside of the sociocultural phenomenon, the lifestyle. In Colombia, we have a great diversity of lifestyles, and that is where sometimes we find the problem. Now, we're well aware of the importance of classifying food according to their degree of industrial processing. That is something that Brazil proposed, and in this case, avoiding ultra-processed foods and to base our diet on natural food and only using processed foods in moderation. That is something that has been recommended by both Brazil and Uruguay. I know my colleague will be talking about this, but these are very good graphics. Here, for example, if we look at tomatoes, a natural food, here at the bottom, it has a sodium content that is intrinsic to that natural food. Then in the processing, in addition to that sodium that's intrinsic to the tomato, we add salt. But then, in addition to everything I already mentioned, here we have even more salt and different types of sodium that's called occult sodium. And that could be sodium benzoate, perchlorate, and in the case of meats, for example. So that is what we are well aware of in public policy and in public opinion in Colombia. And that is why we think it is important to begin to make the problem of sodium more visual by reporting on industrial processing. Also, there's clear evidence that shows how consuming ultra-processed foods has a direct correlation with hypertension. In other words, sodium is one component that ties in, but there are other things contained in ultra-processed foods that also contribute. And all of that has to do with cardiovascular disease. There are cohort studies, there are meta-analyses, systematic reviews of the literature that establish all of this very clearly. Now, what is the problem that we see in Colombia? And we could say that this is a problem that can also be seen in the rest of Latin America. This is an article that was published just recently, and it shows that between the first and the last survey on food consumption in Colombia, the consumption of ultra-processed and processed foods has gone up alarmingly, and that fewer natural foods, fewer foods prepared at home are being consumed. So this is a problem. In addition to what I've already said, what I'm emphasizing is that the trend is working against what we need, which is natural food consumption. And that in Colombia represents something like 13% in recent years. Now, this information would have to be updated, but this in and of itself speaks to this purpose. Now, the use of sodium in these ultra-processed foods where we see a greater consumption in Colombia are ultra processes with baked goods, snacks that are salty, and ultra processed meats. Also, we have evidence that shows that the portion of consumption of these ultra processed foods often has a greater sodium content than using the salt on the table. So with that, we have been able to determine the sources of sodium in our country. So in keeping with that, and taking into account the PAHO nutrient profile, where there's a definition of ultra-processed foods, and that also gives us a visual that shows how the increase of these foods has increased throughout Latin America, and also taking into account the recommendations by WHO regarding sodium consumption in adults and children. We, in our public policy, have taken into account the cutoff points. When is sodium excessive in a processed or ultra-processed food? That is panel C in the nutrients profile of WHO. And in the most recent survey that was done here in the country, we have found that for each, or in the case of sodium content, more or less 90% of the population in Colombia consumes at least one product where there is excessive sodium content. In other words, that is a processed or ultra-processed food that has an excessive sodium content per day. And something like 20% of the population consumes 4 products with excessive sodium. Once again, processed, ultra-processed foods per day. And here you can see total fat, free sugar, saturated fat, trans fat. And here you can see that the products with excessive sodium are those that are most consumed in Colombia. Now, in doing an epidemiological analysis, looking at probability risk, we see that the people that consume at least one product with excessive sodium content in Colombia's population has between 3 and 4 times the probability of having a diet with high sodium content. And of course, there is a relationship. There is a high content of products with a high sodium content, and of course that is related to high sodium consumption, and that in turn is related to diseases that are high in mortality. So this is a measure taken in Colombia to deal with this problem. Recently, and I'm talking about a couple of years ago, a law was approved. It is called Healthy Food Environments. And Article 5 talks about front of package labeling. And that front of package warning was designed in keeping with the degree of industrial processing, taking into account the evidence available with no conflicts of interest and the recommendations of international organizations. And that is translated into this labeling that I'm showing you. Here you can see that this covers the right to information. Colombians need to be informed when a processed or ultra-processed food has excessive sodium content. And this has also been linked to other proposals where these same products have an additional tax so as to discourage their consumption. These two proposals that are interlinked also tie in with other components. In this case, it's also processed and ultra-processed foods related with chronic diseases. This has been implemented in recent years. Now, to conclude, what can we say so far regarding sodium content in processed and ultra-processed foods in Colombia? One, that they are the major sources of sodium in the diet. Also, that there has been an accelerated increase in the consumption of these products in our diet, displacing biodiversity of natural foods and local gastronomy that is related with a more healthy lifestyle. Also, we can say that we have followed the recommendations of PAHO and their nutrient profile, and we have implemented the strategies that have been implemented in other parts of Latin America, and that is the front of package warning, once again taking into account the cutoff points recommended by WHO. And here, this ties in with what a colleague will be presenting later on, which is the implementation of the sodium content targets in Colombia. The whole idea is that bit by bit, we will be able to reach the targets of sodium consumption, thus decreasing high blood pressure and related diseases. Now, the challenge is to follow up the impact of these measures by looking at public policy, coordinating policies, and also looking at the country's installed capacity. So I stop here. This is my email address, and also I will continue to await your questions at the end of the event. Thank you. This is very interesting. It is good to see that you have a comprehensive policy with ambitious targets to reduce sodium in the diet following the PAHO nutrient guidance. This is very encouraging, and we will be supporting you in this effort. And as you said, monitoring is very important. And it will be good to see how implementation of these targets works. And this is a great example for other countries to show that these policies can be implemented and approved.
So if you have any questions, please, you can touch the question and answer button. And at the end, we will have a brief discussion space. Let us now move on to our second panelist, second presenter, Dr. Florencia Hooker, who's a researcher, an independent researcher. She is a dietist. She has a master's in nutrition, emphasizing in public health, and she specializes also in topics of pregnant women health and also problems of childhood and early childhood. And this is in the Ministry of Social Development in Uruguay. She will be telling us in her presentation about sodium consumption in minors under 5 years of age. So let us move on, and I yield the floor to Florencia, who's going to address this. Just to clarify that I'm not a doctor, I'm a lawyer or a specialist in nutrition, perhaps. I have a title as a nutritionist. Let us move on to the information we have regarding sodium consumption. We will be giving you information regarding sodium consumption, giving you an overview of the consumption and the impact of products in the short and medium term, and the problem that this represents throughout Latin America. Uruguay is a small country, 3.5 million inhabitants. 95% of our population lives in urban areas. Child poverty is 20+%, and the general population, it is at 10%. So we have a large concentration of poverty among younger children. And to show you now, tell you about the small population, last year we just had 31 children born, which impacts life expectancy, which is 78 years of age. This is just to give you an idea as to the importance that every child, boy or girl, has upon health and our economy as well. Also relating to the specific rights to boys and girls to grow in a healthy environment. As regards consumption during early childhood, it is clear that in Uruguay too, the main problem has to do with salt and problems of stunting and other issues which are an additional challenge. As I was saying, we will be giving you consumption data, information. The first has to do children with 0 to 5 years of age. The National Survey, Nutrition for Child Development and Health survey, which is used with a panelist methodology in order to monitor the development of public policies connected to early childhood. In this study, plus the general survey carried out by a representative group in our country, and when we look at the information which are being reported, children between 6 to 24 months, salt is not recommended. Practically half of the children have problems or foods with additional salt. Also, depending on the age, whether this is in Montevideo or in the rest of the country, and of course, the economic level of the households where these children live. And an information which is not irrelevant and which is part of the consumption survey in households, the estimate of apparent consumption of sodium was observed in countries that have a higher level of income as opposed to that which happens in other countries. When we look at what is happening in children between 2 to 5, we see that 80% of children, 90% consume products with excess sodium, which tells us about not just the consumption, but the actual amounts. And 32% of the calories consumed by these children come from ultra-processed foods. And although when they grow older, this becomes more important. And in children under 1 year of age, 1 of every 10 calories comes from these products. And the impact, of course, this reports for health in the short and medium term. When we look at the actual excessive sodium consumption in children between 0 to 5, we had this figure of 1,221 milligrams per day, and children from 6 to 12 years of age, consumption accounts for 68%. And as we just stated, greater consumption takes in the higher income households. We have information of school-age children within the framework of the assessment of the school nutrition program back prepared back in 2018 in Montevideo. Children of fourth, fifth grades, including children from 4 to 5, 4 to 6, and we see that 90% of the children with an average consumption of some 2,000 milligrams, this represents an excessive salt consumption. And as the age is larger, greater, consumption also increases. Something which is indeed very important is that those children that have more meals in their schools, given by the school nutrition program, have a lesser level of this excess consumption. So this is indeed a protecting factor when we're dealing with sodium consumption. When we look at this 1992, which was the measurement unit, see that 30% of the calories come from ultra-processed foods, whilst the source of sodium, 28%, also is coming from ultra-processed foods. So indeed, this is an issue which is part and parcel of all the socioeconomic levels and age levels, and which is associated very strongly to the consumption and intake of sodium. Other study that we have been working with Gustavo, another panelist, where we realized that both in the in this survey as well as the school age children, we made an additional study which wanted to estimate the consumption of natural processed and ultra processed foods within the profile of children nutrition. And although these studies include all nutrients which are linked to non-communicable diseases, I will just mention information which pertains particularly to sodium consumption, sodium intake. In the records, at the level of school children, we conducted a study 24 hours among students carried out by people who are experts in nutrition, and for utilization of this tool using the reminders and records with the NOVA system. And thus we were able to obtain the results for processed and ultra-processed foods in keeping with the PAHO nutrient profile. The intake averages, as you can see up front, among the population of children 2 to 5 years of age was 1,300. And when we analyze this consumption average among children, those which had not consumed any ultra-processed foods, we see that the average then is much lower. And in those where at least one product was included, we see that the increase is considerable, practically threefold as compared to those who do not consume this type of products. Same thing with the school age children. For consumption, practically gives us 1,100 milligrams. And as we include other foodstuffs, you see the figures concerned up front. Another piece of information that we were able to observe was that the intake of children it can be explained because of the large number of ultra-processed foods involved and the non-recommended intake and the number of grams of excess product of this critical nutrient, which increases the probability of an inadequate nutrition as opposed to the intake recommendations regarding sodium. As you see, for every milligram of sodium, Gustavo said this earlier, among adult population, for every milligram of sodium coming from these ultra-processed food or excess of nutrients, in keeping with the model of nutrients of PAHO, we see that children between 2 to 5 years, this increases by 5.56%, and children's school age, it is 4.67%. Both of these figures are significant as compared to those who do not consume this type of products. By way of conclusion now, we would like to highlight, as a result of the study, we see that the intake of products with excess sodium, according to PAHO, and every additional gram consumed of such products, the quality of the diet is affected significantly, infringing the recommendations of PAHO for these population groups. We would like to highlight here, and here rounding up our presentation, we must say that Uruguay does have information regarding the intake of critical nutrients and general nutrition habits. It is important to say that sodium consumption is present in children from a very early age, and it increases as well as age increases as well. Consumption is present as of 6 months of age. We do not know earlier because the surveys are made only starting at 6 months of age. There are problems also with breastfeeding. 22% of children between 2 to 5 and 40% of children in school age consume 4 or more products containing sodium. Although we are far from the 90% that Gustavo mentioned, we're dealing here with population groups which are more younger. And Uruguay is a little bit better in terms of percentages as compared to other countries and the total percentages of these products. The ultra-processed foods represent up to 30 to 50% of the total number of calories and 40% of sodium at the school age level. And this is all framed with an imbalance of nutrition. Consumption of fruits, vegetables is insufficient in the case of all of the group ages. The consumption of these products with an excess content of sodium worsens significantly the quality of the diet, and it is far from the recommendations, and it has an important consequence in the case of consumption of products having excess of sodium, which makes children not to be within the possibility of having adequate nutrition. By way of conclusion, in this brief overview, Uruguay has a great challenge in terms of food policies. There are problems of excess and deficit. Anemia is present in 1 out of 3 children, and stuntus appears in children less than 5 years of age. We must prioritize national strategies promoting and facilitating better food practices based on natural and processed foods at home, trying to eliminate ultra-processed foods and those factors that give way to healthy growth. As we said earlier, Uruguay is implementing as of 2021, and the present criteria are far away from PAHO's proposal. And we as a country, in view of the figures we're showing you, we should advance and harmonize all these criteria with those suggested by PAHO. It is necessary to broaden and strengthen policies to reduce the demand with excessive contents of these nutrients and improve the quality of the diet. Uruguay is making great efforts in order to broaden. We have to broaden such efforts and to perform in a more synergic manner with regard to all the strategies that the state is implementing to ensure the right to healthy nutrition, better the quality of life of future generations. As I said last year, just only 31,000 children were born in our country. We don't have difficulties as far as language is concerned. We don't have a country with tremendous difficulties from the geographic aspect. And 95% of our demography is in urban areas. We have many advantages to grapple with this problem, and thinking in terms of state policies, we must ensure the right of every child, boy, girl, and teenager to have adequate protection. In this way, future generations will have better protection to fiscal policies, and also the labeling, the front labeling of foods with criteria which should be even more strict than the ones we have today. And we should begin this process by way of the maternal milk substitutes code. Thank you so very much. And I leave you the information of the work we have been doing. And I state that I have no conflict of interest, something which I said at the beginning of my presentation. Thank you. Thank you so very much, Florencia, for your presentation. And we see with a tremendous concern that as of a very early age, salt intake is excessive. And indeed, this means that from a very early age, children become accustomed to eating salty and sweet foods. This trend continues throughout childhood and adolescence, and then when they become adults, of course, this is why this study is so important. Just to say that we do have already very many questions in the question and answer key, some for Gustavo. So perhaps he can start respond to those questions. And with this, we will continue on now with our next presentation, which will be made by myself. Therefore, I will be sharing my screen with you right away.
Un segundo.
Just a second.
A ver. Acá está y espero que todos lo puedan.
Okay, here we are. I hope you can all see my screen. I'm going to be talking about the updated regional targets of PAHO for sodium reduction, and all of this with a view to contributing to lowering sodium consumption by 30% in the population. That is a target that was set by the World Health Assembly to be reached by 2025. So just to remind you that salt contributes to hypertension, to cardiovascular diseases, and other non-communicable diseases, NCDs. It is estimated that 80% of the people who die in the region die from non-communicable diseases, and especially cardiovascular disease. By reducing excessive salt consumption, we can avoid hypertension and also prevent 10.8 million deaths. Now, salt consumption recommended by WHO is less than 5 grams per day, and that is adjusted in keeping with a dietary intake for children. And their consumption should be lower. Now, there is no minimum recommendation. It's not clear whether or not you need a minimum of salt, but that minimum can be achieved by consuming natural food and with the sodium contained naturally in those foods. Now, currently, the consumption is 2 or 3 times greater in the region, so well over that maximum limit of 5 grams per day. And this, to a great extent, is due to an increase in consumption of ultra-processed foods. We can see that there was an increase in the number of calories coming from ultra-processed foods per capita between 2009 and 2014, and the projection is that that curve continues at an accelerated pace. And many countries are already having their processed and ultra-processed foods as the greater contributor to sodium intake. That is something that we see in many industrialized countries, where 70 to 80% of the salt consumed by the population comes from processed and ultra-processed foods. And that is why it is so important that this measure of setting a ceiling, a maximum limit on the consumption of salt in processed and ultra-processed foods be set. Also, I wanted to point out that reducing salt in food is not the only measure. Dr. Luz Marina de Regil will be talking about the SHAKE program. Everyone is acquainted with the SHAKE. It is currently being updated. There are 5 lines of action. The first line has to do with surveillance. It is important to know what the main sources of salt are in food, and also how much salt is added during cooking or at the table when consuming these foods. So that all ties in with surveillance. We need to be acquainted with consumption, main sources, the content of sodium in different foods. Also, we have working with industry to reduce salt in food. And also the frontal labeling is a very important measure so as to be able to easily identify those salty foods and strategies having to do with changes in knowledge, educational strategies, communication campaigns, especially if a lot of salt is being added at the table, but also so as to create a demand on the part of the population calling for food with lower sodium content. Also, we're going to have a course on social marketing. All of that ties in with public health. That is something that will be free access. And also, we are preparing a manual to support communication campaigns so as to reduce salt consumption. Also, we have work with educational centers. That would be schools, other places where we can establish some control over the salt being added to foods prepared in schools or that are offered for sale. With that, we can prevent cardiovascular disease, we can reduce mortality, and we would have a very positive impact on manpower in the health systems that would lower the costs of health care and promote economic growth. All of these measures are what we call the best buys. In other words, the most cost-effective interventions that exist in the area of public health. Now, I am going to refer in greater detail to the updated PAHO regional sodium reduction targets. This was published in 2015, and then the publication was updated in 2021. Now, there are two documents. One contains the targets, and the other is more an advocacy document. And there you will find questions and answers having to do with this reformulation. Also, I should mention that we have 16 different categories of foods where we have established targets for sodium reduction. Also, there are many subcategories, and the reduction should be done gradually. Here we can see for the category of bread products, and crunchy bread products, there are different subcategories. Here you can see 1A, that is buns, bread, loaves of bread, and in the target for 2022 is 360 milligrams of sodium, and then by 2025, the target is stricter. Now, we established these categories using data that we have in terms of consumption of sodium content. In 2022, the goal is to reduce by 15% the mean of sodium content currently in the food sold in the region. And for 2025, the target is a reduction of 30%, 30% of the mean. In that connection, these targets also supplement the reference values of WHO that established values that are more rigorous for sodium reduction in different foods. Now, In addition to the target per 100 grams, we've also compared where those foods would be in terms of milligram of sodium per 100 grams would fall. And after reformulation of the excessive sodium content. So in that connection, the other policies to reduce demand continue to be important. And that would be, for example, the front of package labeling, etc. Here you can see the second document, the document that I had mentioned. It's more a policy document, and there you can find questions, the frequently asked questions, and all of this is available on our website. Those who registered, where you registered on that same webpage, you will be able to find, following the event, you will be able to see the recording from this presentation and also the talks given. Now, to summarize, there are some actions that countries should take. It is important to have leadership, and that leadership has to be in the government so as to implement a national initiative. It's also important to adopt the targets. We recommend that they be adopted and be made compulsory. That is something that Paraguay has done with bread, and Colombia is doing this now too for other categories. This allows us to have ambitious targets in keeping with the WHO nutrient profiles, and also it allows industry to reformulate because all of the industry would be operating equally. So if it is a law, it is harder for it to be repealed if a new administration takes office. So it is good to have mandatory regulations, much better than having a voluntary initiative. It's also important to implement the other policies that I mentioned because they are part of the shake package. It's important to promote healthy nutrition based on natural food instead of using processed or ultra-processed products. It's also important to promote multisectoral action, thus avoiding potential conflicts of interest. And with that, I conclude my presentation, and you will be able to find much more information on these websites about salt reduction. So thank you very much. I'm going to stop sharing my screen, and with that, I can now introduce our next speaker. We will be hearing from Gabriela Flores from the Ministry of Health in Argentina. She has a degree in nutrition from the University of Buenos Aires and a specialist in managing social organizations. She has a postgraduate degree in nutrition that is plant-based and also a master's degree, and she also has a doctorate in public health. So our speaker will be talking about the experience of Argentina. Argentina was actually one of the first countries to take this issue seriously, and she will be talking about sodium targets in Argentina 10 years after its approval. So Gabriela, please go ahead. We can see your presentation, but we cannot hear you. Please open your mic. Yes, yes. I'm sorry. Somehow I could not get my microphone to come on. Can you see my presentation? Yes, yes, very well. Thank you. Okay, good afternoon. And I apologize for that delay. First of all, I wanted to thank you for inviting me to speak to our experience here in Argentina. And I wanted to clarify that I have no conflict of interest and that I work with the Ministry of Health and the University of Buenos Aires, now where I teach. Now, this country implemented a strategy to reduce sodium content in the population, and that was 15 years ago. The epidemiological status in Argentina in terms of consumption back then was that 25% of the population always added or almost always added salt to food after it was cooked or when they sat down at the table. The consumption was 11.25 grams of salt per day, and the consumption of bread in the country represented something like 25% of the sodium received through different foods. Also, there was a lot of consumption of processed and ultra-processed food. Now, based on that information and with other epidemiological data on hypertension and vascular diseases, NCDs, we formed a national plan to reduce sodium in the population. There, the objective was to decrease the consumption of salt in the population overall, so as to reduce the health burden represented by NCDs, especially cardiovascular disease. And that was implemented as part of the national prevention strategy to control NCDs. And it was implemented in two well-differentiated stages. In 2009, we began a voluntary stage where Action 1 was to reduce the content of sodium in bread. There, we worked with bakeries. We worked with more than 9,000 bakeries throughout the country. And then years later, we entered into an agreement with the industry. They signed voluntary agreements. That was done with 58 different companies covering 793 different products, and the reduction went between 4 and 32%. That really paved the way for us to be able to enact in 2013 Law 26905. That was the first law in the Americas to reduce the consumption of sodium, and we were the second law worldwide. Now, this law has different main points. One is it establishes a maximum limit on sodium in some food. Also, there are different actions taken in restaurants where there is importance given to having things on the menu that are low in salt. Also, on the menus, there are warnings regarding salt content. Also, salt shakers were removed from tables, and there was dietary salts provided. Now, there were awareness campaigns. Also, the individual envelopes of salt that were handed out were reduced from 2 grams to 0.5 grams. And also that went hand in hand with an educational campaign. Now, our country is a federation, and federal laws have to be respected by the provinces. And in terms of the maximum sodium limits, that is part of the food code, and that is compulsory in terms of compliance throughout the country. So right now, there are 11 provinces out of the 24 in the country that are complying with the law. There is one province that has its own standards, but it does comply with all the standards in the law. And then there are 9 provinces that have their own regulations, although they do not comply with all the standards. And there are 3 jurisdictions that have no regulations. Now, this is an area where the Ministry of Health has been actively engaged to assure compliance with the legislative norm throughout the entire country. Now, when the maximum limit for sodium was established, it became part of the food code. And the law says that the Ministry of Health needs to include new foods on the list for reduction. So in that way, we included 5 more products to do a reduction. And also we included sauces and different types of dressing to this legislation, establishing a limit on salt content. Now, there are different monitoring actions being implemented so as to be able to evaluate the results of the implementation of this law. There is a program of surveillance to reduce salt content in food, and that is part of our oversight. Also establishing different food products, different materials that are in contact with the food. That is the responsibility of the National Food Administration.
In the Ministry of Health and also the jurisdictional health authorities who are in charge of controlling that foods which are marketed will meet the maximum limits established according with the law. This is done by sampling, and it applies to nationally produced foods as well as imported foodstuffs. On the other hand, and according to the most recent national surveys, these initial consumption data, which I mentioned, were analyzed, and the indicator that the population always adds or almost always salt after cooking when they sit at the table declined significantly according to the national survey of 2009, where it was about 25%, and it went down to 16.40% in the latest national adverse factor survey. Sodium intake was also reduced. Minors under 18 years of age contained 7.9 grams of salt per inhabitant per day, having differences according to sex. It's greater among women than men. This was detected, and as a result of these results, we were able to stimulate 24-hour intake. This can be compared with the initial information of 11.25 grams, but the reference factors were different. But this indicates what the sodium consumption was in our country. However, the prevalence of salt intake above 5 grams, which is the WHO recommendation, is of about 90%, and this is greater among people who have health coverage, public health coverage, as opposed to those who pay for those services. And there's a possibility to make further progress on this matter. Another analysis we carried out was a standard mapping. World Health Organization analyzes different interventions to improve quality of the diet, and the possibilities that were analyzed as a perspective are the 4 that have to do with the reduction of sodium intake, with the reformulation, of course, the improvement of the environment to reduce sodium consumption, communication campaigns, as well as frontal labeling for foods in order to regulate sodium consumption. We analyze all of the national legislation and provincial legislation as well, and supranational standards that we have in our country, and we have a law framework, which is very important. The last one had to do with the frontal labeling of the foods, including regulation of advertising, sponsorships, in the case especially of children, uh, adolescents, and the school environment. All of this set of norms, plus the law 1905, have collaborated to the reduction of sodium consumption in Argentina. Recently, when this has not been published as yet, an analysis that has to do with compliance of the maximum sodium limits established in keeping with the law, comparing with international standards determined by PAHO and WHO. We conducted a horizontal quantitative qualitative study analyzing the recorded food products and the national registration of foodstuffs in a sample that was made up by 7,100 products, which are now touched by the law. And once we obtained this sample, we were able to calculate sodium content in percentage milligrams for each one of the products, dividing into the four groups touched by the law. And we also calculated the degree of dispersion of the amount of sodium in the product with the variability coefficient. And we compared the maximum limits in Argentina with those of PAHO for 2022, 2025, as well as those established by WHO. Besides, we compared the sodium levels and we divided the foodstuffs into those groups which were meeting or not complying with the law. And we also took note of the products that exceeded the maximum limits, both by groups as well as categories and subcategories. Our country has four groups at this moment. These are the meat derivative products, um, the soups and broths, and the other subcategories for which we have established the maximum limits according to the food code. Most of the sample was made up by cookies, uh, loaves of bread, snacks, and so on. Then we had the meat products, then the sauces and dressings, and finally broths and soups. As regards to the actual results, the degree of compliance that there was for these products considered as acceptable for 3 out of the 4 groups were having compliance between 90 to 95%. And the sole group which had a lower compliance group was that of sauces, dressings, and preserves. When we analyzed this information according by the various categories, we realized that the group of these dressings, preserves, and sauces had a lesser degree of compliance in view of the sauces, especially where there was great variability as regards the difference there is in the degree of compliance as compared with other categories. So we focused on that group and we analyzed especially, and this is perhaps a too broad a point to discuss it here, but we conducted a new analysis and reclassification of this group, and the degree of compliance then went up to 60%, which continues to be quite low. All of this analysis was made for each one of the 63 subcategories, but this is much too much information to present it here today. Although the degree of compliance of these limits established in Argentina is quite high, whenever we compare them with the WHO goals and those of PAHO, the degree of compliance goes down, particularly in the case of meat and derivative products, which tells us about the need to update our limits here in Argentina. This is why what we did was a whole analysis regarding comparison of a median sodium content for each one of the categories and subcategories with the national limits, since all the median values were under the national limit to thus bring about an update of such limits. So the work uh, required an analysis of these differences. You can see here only the one with the groups having lesser percentual difference between the median and the present day limit, and reductions in this group of a 15% have been proposed, the group 12, 20, as well as the group 30%, because at present limits in our country are being updated. We have a discussion group for each one of these subcategories, and this becomes very complicated and cumbersome. So this is a proposal which is now under analysis that would eventually allow to update all of the limits. Whenever we assess these new limits as regards sodium content of food, we saw that many of the foods already comply with the limits, which tells us about the real possibility of carrying out these updates. By way of conclusion, we can say Argentina was the first country in the Americas and the second in the world having a law that will promote sodium reduction, and was a pioneering in the region in the implementation of maximum limits in a mandatory way for processed and ultra-processed foods. Although the levels of compliance are quite high, since 3 out of the 4 group had compliance of about 90%. When we compare these with international standards, international goals, this happens to decline substantially. Something which we analyzed and which seems to be a relevant piece of information has to do with the degree of dispersion within sodium content for each one of these products, each one of the subcategories and categories. And in 9 out of the 11 categories, we're able to analyze this dispersion, which is very high, in some cases up to 90%, which tells us that the technological viability for sodium reduction in such products is feasible. It is further necessary that these standards are always updated so that it doesn't do sufficiency as regards the objective it is seeking, the reduction of sodium consumption in the population. However, it is considered that we must reduce the present limits and incorporating maximum limits. There are certain categories that have that WHO and PAHO has that we do not have. And this is what we're focusing on today in order to update our standards. Thank you so very much.
Muchas gracias,
Thank you. Thank you so very much, Gabriela. Indeed, very interesting this overview
de la
that you have
historia
given us
argentina.
about the situation in Argentina.
Bueno también que
It is also wonderful that you may have
también
documented all this information, that you may have conducted studies showing the actual need
estar actualizando
to
permanentemente.
permanently
Y
update
bueno, vamos a seguir pendientes
this information.
de
We will
esta
continue
nueva
to be attentive to
actualización.
these new
Escucho también
updates.
con mucho
And I
gusto
also see with much satisfaction that the regional goals of PAHO and the reference values of the WHO are also being taken into account by way of a reference. And we see that this experience has been quite successful based on voluntary efforts, but that were the goals perhaps were not as ambitious as we would have wished. So this is why indeed it is a very good thing that today we have this update. Now we come to a more recent experience in the implementation on a mandatory basis that will be made by Colombia. And the presenter will be Pamela Elizabeth Vallejo from the Office of Nutritional Health, Foods and Drinks in the Ministry of Health and Social Protection in Colombia. She's a nutritionist, dietist, has a master's in food technology from the National University of Colombia, having experience in the field of surveillance and public health, formulation, development, and implementation of public policies for food and nutrition. And she will be telling us about the development and implementation of the goals for sodium content in Colombia. So go ahead, please. Good morning, everyone. Can you hear me? Can you see my presentation on the screen? Yes, we can see it very clearly. We can hear you well. Thank you. As Leo has just told us, we will be telling you about the actual development of this law for sodium content in Colombia. For this, this is the contents of my presentation. We'll be discussing the health context in the case of Colombia. How was it that we dealt with this national strategy for salt, sodium consumption reduction, which has to do with maximum contents, and also the advances and challenges we confront vis-a-vis the implementation of these ideas. First of all, let me tell you about the 10 first death causes in Colombia. This is preliminary information dating back to 2023, where we see that the main cause of death are, of course, is ischemic diseases of the heart, followed by cerebrovascular diseases, an important percentage of hypertension diseases, all of which are related, of course, to the excess intake of sodium, which is related to hypertension, basically, but which is followed by an epidemiological burden, which has to do basically with these three main death causes. During 2019, we saw that over 8,000 of these deaths, which a very large burden of these deaths has to do with excessive sodium consumption. And this is an important foundation for the drawing up and development of the public policy. And as we saw earlier in previous presentations, the intake of sodium in Colombia is quite high. One of the highest, as a point of fact, in the region. The last study that we have dates back to 2013, where we saw that sodium consumption was 3.92 grams. And the recommendation by PAHO is 2 grams. So we are almost doubling that intake. In Colombia, we have another recommendation, which has to do with the intake of energy and nutrients for adults, which is 1.5 grams. And for children, it is 1 gram. So this consumption is quite high, therefore, and it purports all these important consequences upon health that we discussed before. As Gustavo was telling us earlier, this this very high sodium intake is basically represented by ultra-processed and processed foods. Over 70% are contributing toward that sodium intake. Here, just to tell you what is the difference between an ultra-processed food or a processed food and a natural product. On the slide, you can see spicy sauces made with spicy chiles, peppers, up to 1,200 degrees of sun, while a hot pepper only has 7 milligrams. So all of this surplus, which is quite substantial, has to do with all the additives and salts which are included in such a sauce. Same thing with a thigh of chicken. Intrinsically, it only has 86 milligrams, while as a chicken sausage has 820 milligrams. And for other products, if you make the necessary analysis, we will also see this excessive content resulting in this ultra-processed and processed foods, for which we have an excessive intake, as Gustavo told us earlier. With this very high intake, back in 2012, the national strategy for the salt sodium reduction in Colombia, which contributes to tries to decline mortality resulting from hypertension, cardiovascular problems, and gradually reduce this intake of sodium until we attain the WHO recommendation of 2 grams of sodium per person per day. So, this strategy was built with the technical advice from the CDC in Atlanta, together also with the health ministry, the industry, the academy, civil society, and we established 5 lines of action, amongst which we have, of course, the gastronomy and restaurant schools, the restaurant sector, where we have developed several much research with which we have been able to reduce salt content in some of the specific preparations, finding that 10% of a reduction as a result of a standardized recipe generated no changes for the consumer. This is important progress because this 10% may be applied also for other preparations in the country. And this is what has been done.
We also published manuals for the gastronomy sector. Also, we have a technical working group working with all these restaurants so as to be able to create healthier menus. And also, we are developing a regulatory proposal that targets the recognition of being able to claim that you're a healthy restaurant, including different criteria. And one of the criteria is sodium reduction. Also, we have guidance for different food support programs where food is delivered to parts of the population. So we want to make certain that those foods being given out not be unhealthy. Now, also we have information, education, communication. There we have seen a lot of questions in the chat regarding these educational or communication campaigns. Now, these are important, and we have developed documents for the consumer, technical documentation too. Sometimes we take part in these sessions, but evidence has always pointed out that this does not have as much impact as regulatory measures can have. Now, under research, here what we are doing is trying to see where the sodium intake comes from, what foods are involved. Also, we look at sodium intake overall. And here under industry is part of the solution. And there we are trying to reduce sodium content in processed and ultra-processed foods. Although obviously the other 2 regulatory initiatives already in place could also have a bearing, because we have the front of package labeling, and also we charge a special tax on those highly processed foods that have the warning on them. Now that is in compliance with our targets of having 20% value added to sales price by 2025. So with this strategy, in a comprehensive way, we are trying to look at all of the sodium intake. We are trying to adapt the environment so that we will have a healthier nutrition profile, and so that the consumer can also make informed decisions. Now, for us to set those targets on sodium content, we followed a methodology. First of all, we looked at what foods were being consumed the most, which ones had the highest sodium content, and that was based on our nutritional survey done at the national level. Then also we worked with industry and we defined subcategories of foods, and we did a quick monitoring. Quick monitoring means that we went to the different supermarket chains, we took pictures of the nutritional panels, and we developed a database in terms of sodium content. With that database, looking at sodium content, we set targets, goals, and also we set different time frames. And in that way, we set up the technical working groups and proposed a group for research and development. Here you can see 3 different types of cheese: fresh cheese, this is a paste, and these are spreadables. So here you can see that fresh cheese can reach almost 1,000 milligrams of sodium, but by establishing the goal, which is the median, in this case, almost 600 milligrams, we would be able to bring down by almost 400 milligrams the amount of salt. And the lower limit here would be 400 milligrams. So there you can see a significant reduction. Here it's important to point out that the data is between the upper and the lower limits, and that in some cases, these would be very salty types of cheese. You can see that they are all the way up here, and there a more important effort would have to be made to reduce that very high content. This is a case, but we have many other cases because there are 59 different programs in this regulation. Sometimes we weren't working with an upper and lower limit, we were working with a percentile, and that has to do with the technological condition of the products, the nature of the products, the additives that are used, the technological capacity of the country. All of that is important so as to be able to make these projections. This regulation process requires mentioning that there are some administrative steps that take quite a bit of time. This project began back in 2013, and it expired in 2020. So it was about 7 years of technical working groups talking to the industry. And here I should mention that there was always significant resistance on the part of industry, because for industry it was complicated. They were afraid that this would affect their sales, or that they would not be able to develop enough technology to be able to reduce that content. So there was always resistance, saying sodium isn't important for health. The sodium has nothing to do with non-communicable diseases. So we had to provide all the scientific evidence to be able to reach this standard. So a lot of work was involved. Here we began doing a normative impact analysis. There was an initial consultation, then another consultation at the end of the process. Then there was a national consultation on this regulation. There was an international consultation too. Then we had to do the international public consultation, advocacy. And so this process took a long time because of the lengthy discussion with the production sector. This took much longer than what we had foreseen. Here, This is how we did our regulatory impact analysis, how we got all the scientific evidence saying that we did have a high consumption of sodium in Colombia's population, and also that we had to have evidence that sodium does contribute to high blood pressure, that it involves a high health cost, and that this affects our population. And also we looked at the disability adjusted years of life. And then we looked at different alternatives to improve the problem. We came up with these three things: the status quo, business as usual, regulation, and educational campaigns. And here on this chart, you can see that we were able to determine that although educational campaigns do have a significant impact, some health benefits, regulation has a more effective effect. And the cost effectiveness is much better than looking at educational campaigns. So since we see this analysis on the regulatory impact, all of this gave us as a country rationale to say that this is the best alternative to reduce that high level of consumption. So we issued Resolution 2013 and 2020, establishing two gradual targets, one for 2022, one for 2024, covering 59 products, including bakery, also packaged crackers and cookies, sausages, that would be luncheon meats, other types of sausage, then sauces and dressings, that's a large category. And we have mayonnaise, ketchup, and also soy sauce, pesto, etc., etc. Then we have soups, broths or bases, dehydrated cream soups that has a high sodium content. Then snacks. Snacks are a big category of ultra-processed foods. And there we also have some significant reduction targets. Then fats, breakfast cereals. Breakfast cereals is a product where people don't expect to find such a high sodium content. And what we have seen is that the salt content is high and that it's a product that is usually consumed by children. So it is important to establish those targets. And then we have cheese and canned sardines. Here you can see the different targets. I talked to you about dehydrated stock. Here you can see the first target, 21.60, and then the final objective is 18,000. That means that we are lowering our target over the 2 years, and then you can see the whole list of different products that are on the market. Now, the date that goes into effect, the first goal was to do it 24 months, and then target 2 would be 48 months. And the final compliance would be in place by November 9, 2024. Here we have the development of the technical capacities, and this was training given to persons in charge of surveillance and control. The regulation establishes who is in charge of this. That is the National Institute of Surveillance of Food and Drugs in Colombia. That's INVIMA in Colombia. And there, the training was quite intense. For the implementation of this regulation, we also gave training to the productive sector in different settings. We developed an ABC to implement the resolution that is on the ministry's webpage, because the production sector is always asking, is my product part of this definition? Yes or no? So this helps understand the definitions, and also it looks at tariffs and whether or not the product is part of these categories. Then also last year, we amended the resolution because in In 2013, we had modification done by third parties. That means that a third party had to be hired to evaluate sodium content. So we changed that because it was a rather significant cost that had to be paid by producers. Then lastly, the challenges, we have to finish the implementation this year. The second target has to be met, and we have to evaluate the implementation of the regulation. That is another challenge we face. We have to follow up on compliance with this regulation and then continue with the other lines of the national strategy to reduce the consumption of sodium. And these are gains for the country. In keeping with our regulatory analysis, we are thus avoiding 316,000 deaths with the resolution. We are reducing the cost of associated diseases, and we have a considerable savings in our health care system. The interpreter corrects herself. We are avoiding 3,900 deaths. Thank you, Pamela. That was very interesting, a very interesting presentation. Thank you for reporting on the progress you're making and this whole process that you have had to go through so as to be able to accomplish these results. So the debate continues. I see that we have some very interesting questions in the Q&A. Those questions are being answered, and at the end, we have one final presentation. Then we will have some time for Q&A. So with that, I call on Dr. Luz Maria de Regil. She's the unit head of the Multisectoral Action in Food Systems, Department of Nutrition and Food Safety at the World Health Organization in Geneva, Switzerland. She works on policy and actions and how to reduce sodium and update the technical guidance. She also looks at micronutrients. So Luz Marina has a degree in nutrition and food science from the Ibero-American University. She has a master's degree, and she has a doctorate in public health from the National Public Health Authority in Mexico. So Luz Marina, please go ahead. Thank you for your invitation. Can you see my presentation on the screen? Yes. Great. Thank you for the invitation. Thank you for this opportunity to report to you on what WHO is doing to update the different tools we have to advance the programs to reduce sodium consumption. First of all, I want to begin by congratulating all of the speakers because it is truly inspiring to see the efforts being made across Latin America to reduce sodium consumption. And in Latin America, we see that we are really pioneers in all of these policies. Plus, Latin America has made a significant effort to generate evidence and share it. And that means that other countries can adopt these policies because they are evidence-based. So congratulations right from the outset. As Leo was saying, and as the different presentations have said, reformulating food is one of the most important interventions to reduce sodium intake. It's not the only action, but it is the one that has the greatest effect on the population, especially in populations where the consumption of highly processed foods or processed foods is the greatest. Now, it is less effective in populations where the consumption of ultra-processed foods is not high. So it's not only ultra-processed foods, it is food that is often fast food where people eat a lot out of the home, where it's hard to predict the amount of sodium contained in that food. Now, those of you who are not acquainted with this, you should know that the World Health Organization published the first global report on sodium consumption. And that contains an analysis on policies. It shows where countries stand in the policy area, but also the idea is to model progress and to look at the consumption of sodium on the part of the population. And also it talks about what can be done to lower sodium intake. Here on this map, you can see that in dark green, that means that the population has one or two mandatory policies to reduce sodium consumption. Now, lighter green, that means there's only one mandatory policy. In orange, that means that the policies for sodium reduction are voluntary, and in red, there is either no commitment nor mandatory policies to reduce sodium. So as you can see on the map, Latin America has made major strides in implementing policies, plus those policies have been made mandatory. Now, it is not something that spans the entire hemisphere, but it does show greater progress than in other countries. So what we're saying is it is possible to further reduce sodium content, sodium intake, when you try to move from red to orange or from orange to dark green. So it is possible because when targets are set as part of country strategy, they can implement those targets, saying what we want to do is we want to reach a score of 4 on the scorecard, and that is something we're going to do in this way. So that can be done implementing several policies. Now, the evidence behind interventions, as was already said, and that was said by our colleague from Colombia, the strategy can be different. The labeling has an important effect on consumption. It affects purchasing high sodium content foods, but of course, working with industry has greater impact and it requires less effort on the part of the population. As you know, some years ago, the World Health Organization published SHAKE. It refers to a surveillance, epidemiological surveillance. It means taking advantage of industry, working with industry so as to lower sodium levels, having different policies, advancing knowledge, and monitoring and communication regarding sodium consumption. And also, and it talks about what we're doing so as to update SHAKE.
The feedback we get from everyone has been very useful in generating these initiatives, and which has been a very useful tool in order to work in other countries to see what can be done in order to reduce sodium consumption. As part of our initiative, we did something where we a brief where we speak about sodium reformulation in order to reduce sodium consumption, and we presented certain study cases. It has been very useful to see that it's something which is very useful, and many countries are doing it already in a friendly manner for decision makers, where we tell them that it's important to act in that area. Recently, on May the 6th this year, we published the second issue of the global benchmark for sodium for various categories. These are different from the first edition because they include more subcategories, and they are also supported by more regional benchmarks. This makes for them to better respond to the actual worldwide reality. A webinar was organized, and this is available at the WHO internet site in case you want to look at these benchmarks closely. However, and despite we have these tools, the feedback that we have been receiving tells us that the targets indicate what ought to be done. It gives us an idea as to the categories of foods and limits that must be considered for the countries, but it does not give us a practical guide as to what should be done among those who are already implementing national objectives for sodium reduction. So what we're working on at this point in time is a document which has a step-by-step guide in order to help those countries that have not yet established these targets and national objectives within their process for their establishment. So the following slides might be somewhat technical because we will be step by step following what that document includes, but also for those countries which are trying to establish national objectives, I hope that they will leave this presentation with more tangible information. First step to reduce sodium target is to obtain data and determine what is the contribution of processed foods in the total sodium intake, and to determine which categories of processed foods are contributing the most to sodium consumption among the population. It is important that we conduct a demographic analysis if there is information regarding sodium consumption by way of surveys where we take urinary sodium or also analysis of the labeling. Then we have to determine the key foods to establish goals by using goals defined in the global benchmark, sodium benchmarks, of the WHO, having a national dialogue, and I will move on to the more detailed steps on the next slides. To obtain data regarding the product and which products are included in the selected categories as well as their sodium levels. My colleagues who spoke earlier, together with I believe that it is not an easy exercise. We look at the 100,000 foods to place them in the various categories. We have to make decisions, having an adequate process to be able to carefully analyze what are the actual consumption sources and how much are they in keeping with the benchmarks. We must establish goals and schedules. The previous presentation told us about that issue. Based and in establishing these goals, first thing is to take into account the international data, regional data, as well as that of other countries, establishing the schedule to establish this benchmark and also to implement the benchmark. It is important that we always have the different steps in our mind to see what is the possibility and what has to be done to adjust them, to adjust the limits which are being established, and how can we guide the industry within that process, and how can we monitor and follow up the implementation of these regional objectives or national objectives. And as I was saying, it is important to assess and update. The previous examples have been wonderful. Argentina gave us a true lesson as to how is it that we can continually analyze and monitor by updating the national values in a feasible way that will actually agree with the regulatory processes. So the first step in order for us to do is to obtain data and determine contribution of food processed foods, sodium consumption, and which of those categories are the ones that contribute the most. The different ways this can be done to a 24-hour reminder, frequency of consumption of certain foods. We have to understand consumption patterns in the population and also include any available piece of information we may have. many countries consider, as particularly when they have very large states or when they consider regional or subnational data, rather, to see whether certain adjustments are required, not so much as regards the limits, but communications regarding such limits, taking into account the regional foods, which are, of course, important for each one of the sub-regional levels. As I was saying, we have to obtain the data, see what is the contribution of processed foods, the total sodium contribution. We can read the labels, we can rapidly evaluate the data at the supermarkets. We can seek out in the websites or food charts or data available through the various national institutions that monitor sodium consumption. And we can always obtain in a broader way, not just sodium, by the way, but also what is the portion of energy that other nutrients, especially macronutrients, contribute. If the information is not available, then a plan would have to be prepared to acquire the information. But this is indeed the first step for us to be able to begin. So here you see how the database is built up that will then result in determining which categories of foods are important by using categories defined as part of the WHO Global Sodium Benchmark. It is not possible for our countries to include all categories of foods, so we have to establish which are those categories that first contribute the largest amount of sodium, and secondly, which are more consumed by the population. And the interaction of these two is what will result in a larger sodium consumption in the population. And this will make it available for us to conduct an exercise where we consider, of course, changing of the national discussion and dialogue priorities such as cookies, cold foods, cold fats, and how much what importance we assign to certain foods, and also whether this includes the ingredients, which must be considered. It's not just the products, but the ingredients in them that contribute sodium within the chain of supply of foods, such as the case of those little broth cubes or sodium, which are included in some. Then we have to obtain the information of all these categories, see what the variation is. In some of the presentations, you can see variation among the various categories, looking at the changes in the products, because as you very well stated, in one same category, variation for the cheeses, case of which was discussed, where the variation level of sodium changes are very important. See what the medium is and what are the adequate valid limits, understanding the actual distribution of the products and how feasible is to be able to reformulate them. First being about the goals and schedules, previous presentation showed this very clearly, but it is important to say that the palette of the people is adjusted to these things. Private industry is reluctant often to adopting changes in sodium content precisely because many instances are related to consumption preferences. However, we have also realized that we can diminish sodium consumption gradually, and the palate gradually adapts to it in very little time, by the way. So it is feasible to reduce sodium and to be able to attain the international goals and the regional goals that may have been established. So it is possible to consider all these changes in the people's palates, but this by no means should be a limiting factor in order not to establish objectives, goals, and limits in keeping with international norms and standards. You also already mentioned these resources that we had earlier. It is important to be able to compare it. For example, how this score as regards to international reference. What are the limits of other countries, particularly for foodstuffs, which culturally might be very important and regionally important as well. It is important for us to have a panel that will be very clear with regard to its area of interest. There will be no conflict of interest. This will give greater credibility to the national process to be as impartial as possible, where the data may be analyzed in a transparent and credible manner, so that this panel of advisors may inform decision makers in the most professional and accurate manner possible. The panel can also include people from different spheres, academy, with various sectors working together. Now that we can record these meetings, it's important to do so, and also to more clearly document all these processes. And we should very clearly establish what is the process and determine at what point in time does the feedback from the industry may be considered in order to maintain this process as free of conflict as possible. There has to be a process of communication with the industry as to how these national goals are to be implemented, the terms, the periods. Some countries give technical assistance in the reformulation of foods, but the process has to be free of any possible interference by the private sector. And as I said, there have to be plans for monitoring, assessment, and update of the goals. This has to be done from the very beginning. Otherwise, unless we establish plans for the future, it's difficult to update these processes of update, assessment, and remonitoring of these goals. It's important to do so because as progress is being made and as we can make more progress than we originally thought of. This is what is included in this document to be published before the end of the year. Of course, it will include more detailed information than what I just told you, because we also have a time limiting factor. But this will, of course, call for the publication of the so-called shape. We're concluding its update. It is our desire that this will be a much more practical guide than the initial shape. So it'll contribute to the designing of the sodium levels led by governments and administrations regarding content. There will be flow diagrams and designing programs, and it also will consider many more options and interventions than the original shape was considering. Having information on many more cases because many more countries have implemented these policies one way or the other. So please be attentive. Around September, the new shape will be available. We will be collaborating, of course, with the regional office for its launching and to analyze the implications of the shake. And how can we communicate this in a better fashion to all countries, not just governments, but all those that help countries in the advocacy and implementation of all these interventions to reduce sodium consumption. With this, I thank you and I return the floor, please, to Leo. Thank you very much, Luz Maria. Great deal of information in your presentation, as well as a mention made of all the tools we have in PAHO, as well in the WHO. And it is always very good to listen to the fact that there will be a new shape guide that will be supporting countries step by step as to how to implement these products for the reduction of salt in a comprehensive manner where the reformulation is indeed one of fundamental components of it. Thank you so very much indeed. And we still have 5 minutes for a few questions and answers that will indeed be conducted by Luis Galicia, who is our PAHO consultant regarding the salt reduction. And I see that he has been indeed very active answering all the questions that we have seen in the question and answer. So go ahead, Luis. Please try to summarize for us the questions and answers that we had.
Primero, muchas gracias a todos los conferencistas. Creo que las presentaciones fueron excelentes todas y dan un panorama general
Thank you very much.
de la situación de implementación de metas.
All of the questions were very interesting, and it had a lot to do with setting these targets. I wanted to remind you that the presentations, the slides will be available on the PAHO website, as well as the recording of this meeting. So you can look forward to getting that. There were a lot of questions having to do with educational campaigns. I just want to remind you that communication or education campaigns are one of the lines of action of the Shake technical package, and therefore this should be part of the sodium reduction programs. Also, I would like to ask two questions very quickly to our speakers. Actually, I already provided you with an answer through the Q&A section, but I don't know if everyone has been able to read that. The first one goes to Gabriela Flores from Argentina. I wanted to ask her, does the law say what happens to those products that do not comply with the targets, and is there any sort of exception? Yes, thank you. The sodium limits, since they are part of the food code in Argentina, that does envisage sanctions in case of a lack of compliance. So first, there is work. We provide a warning. We warn the companies, especially if these are small or medium-sized industries, so they can reformulate, so they can adapt those products. So we can also impose monetary fines, and if the company does not reply or respond to those initial warnings, the product can be taken off the market. Usually that does not happen because they heed the warnings. But yes, our law does envisage the possibility of there being a penalty. And that is something that we look at when we look at the standards in provincial laws. One of the standards evaluated is that that provincial law has to contain some sort of sanction in case of a lack of compliance. Thank you, Gabriela. The next question is for Pamela Vallejo from Colombia. Rahila Nunez is asking about, do you look at sodium intake? Do you look at sodium content in foods, or do you analyze both parameters? Yes, we are developing a proposal to evaluate the regulation, and that regulation, this evaluation standard would have two characteristics. It would evaluate the sodium intake, and that would be done by looking at sodium in urine. That is the methodological way to evaluate sodium intake. And in that way, we can assess the impact of the regulation on the intake. But also, we can do an evaluation, and we have actually planned to do the evaluation if there is lack of compliance with the regulation. And that would be done by a report on the part of INVIMA. That way we would know by category, this is what Argentina is doing, what level of compliance exists in each category of products. But yes, we are involved in that process to do that evaluation. We have not yet reached our second target, so we don't yet have data available. Perfect. Thank you, Pamela. And just to conclude, for both Pamela and Gabriela, Pamela Valles from Ecuador is asking, how did you manage conflict of interest and the pressures of the food industry sector? That is a question that Luz Marina mentioned in her presentation as it being a relevant element. So, could we have a brief comment from you, Gabriela, followed by Pamela? In our case, the initiative, since it began by working on a voluntary basis with industry, and then that led to a negotiation work group working by each category of foods, where we looked at limits, and that way we were able to evaluate the technological feasibility. So the current proposal looks at technological viability with the industry. And the law sets up a national advisory committee to evaluate sodium. And there we have the chambers that represent industry, but also we have civil society, other organizations that are part of government. So it is with that group that we are discussing the totally new amendment possibility. So we will see how this works out. Thank you. Pamela? Yes. Here in Colombia, we in the ministry have a guide that has to do with conflict of interest management, and that includes conflicts that are related to regulations, also to technical meetings, where we follow the format of declaring a conflict of interest. Also, we have technical working groups with industry, with academia, with the government, and we don't want them to have been involved in formulating the regulation. They present the formulation process, and there we learn where the sodium is, what additives are being used, etc. But the whole regulatory process is done by the Ministry of Health. We work with NVIMA, we work with academia, and then the private sector, industry, is involved as a consultation, so we can learn about these processes. So we manage the conflict following that guide on how to deal with conflicts of interest, first of all, by declaring the conflict of interest, and we should not allow the production sector to participate in formulating the reduction targets. Thank you. Thank you, Pamela. Very well. So looking at the clock, and since we have gone over a bit, I give the floor to Leo for him to present us with some closing remarks. Thank you very much, Luis. We still have 300 people connected, so this has been a very interesting webinar. We have seen how important it is to reduce salt, which contributes to cardiovascular disease, hypertension, and non-communicable diseases that represent 80% of mortality in the Americas. We have seen that salt reduction policies are the most cost-effective ways to deal with public health, and especially through the best buys. These are cost-effective policies where reformulating salt content in processed food has been gaining in importance, especially since consumption of ultra-processed foods has been going up in our countries. That is why we focus so much on this issue, but it is important to implement this in a comprehensive fashion, working or having this dovetail with other policies, the front of label warning, advertising, ultra-processed foods, regulating environments, and also looking at communication and educational content as a complement, not something that replaces regulatory policy. So this helps create support for these policies. There are some important tools like updated targets of WHO to reduce salt. These are things that are feasible, that can be done in countries like Colombia. We see that this is being implemented, and Argentina is also updating its targets to make them more ambitious. Also, we have seen through WHO that through reference values, it is feasible to implement these targets.
Obligatoria, podemos
Doing it so in a mandatory way, we can urge the industry regarding its implementation, but obviously they would not participate in designing the goals because of a conflict of interest. It's important to involve civil society. That we continue to obtain information and evidence, scientific evidence that these policies are actually working. And in this event, we have seen also many studies which are more than welcome. It is important that we publish all this evidence. And with this, I wish to thank each and every one of the speakers, the panelists who have been with us today, also our interpreters, and obviously all of the participants. And as PAHO, we are available to you in supporting you in the reduction and implementation of these salt awareness and salt reduction policies. And we're also very interested in hearing what will be the new guides of implementation by PAHO based of the WHO based on the Shake package. With this, I wish to thank you and may you have a very good afternoon. All the best. Thank you.
Gracias.
Muchas gracias.
Gracias, gracias.